Good morning, I'm Vic Senese, and this is UroNurse News. Many people turn to cannabis to help manage mental health conditions like anxiety, depression, and PTSD. But according to the largest review of cannabis studies in nearly half a century, the evidence that it actually works is pretty extremely limited. Now, researchers in Australia analyzed over 50 clinical trials conducted over the past 45 years, looking at different types of cannabinoids, formulations, and mental health conditions. Their conclusion? There is no high-quality evidence that cannabis helps reduce symptoms of anxiety, depression, or PTSD, the very conditions most patients report using it for. Now, some conditions like insomnia, autism, and tic disorders showed a little more supporting data, but even that was considered low quality by researchers. Jack Wilson, lead author from the University of Sydney, told NPR, "We clearly need more research on cannabis medicines. This isn't surprising to cannabis researchers who have long faced major barriers to conducting well-controlled trials, especially because cannabis has been classified as a Schedule I drug for decades. Even as states legalize medical and recreational marijuana, investment in high-quality clinical studies remains limited." Because of this strict study criteria, the Lancet Psychiatry Review included data from about 2,500 patients, and for some conditions like depression, there wasn't a single trial available. Ryan Vandry, a psychiatry professor at St. Johns Hopkins, called it embarrassing how little data we have for such a widely available therapy. It's important to note that reviews like this collapse data across different products, doses, and patient populations. That means some patients may benefit while others do not, and the overall conclusions can't capture individual responses. Another review in JAMA Internal Medicine came to a similar conclusion. Evidence is sparse, and there are substantial risks, especially for adolescents and young adults, and people with serious psychiatric conditions. Dr. Devin Kensagara at Oregon Health and Science University emphasizes, cannabis is not one thing. Its effects depends on the dose, compound, and the patient. High THC products like gummies and concentrates appear to carry the greatest risk, particularly for people with serious mental illness. Lower doses may balance benefits and harms more safely. Cannabidiol, or CBD, is one compound showing potential for anxiety relief, something the Lancet review couldn't fully capture because it's considered cannabinoids as a whole. Ryan Vandry notes, "There's a subset of patients who see tremendous benefit, some who see no effect, and some actually worsen. That's why clinical research is critical." So, take-home message is clear. While public interest in cannabis for mental health has far outpaced the science, we need better, well-controlled studies before making firm recommendations. I'm Vic Senese. This is UroNurse News. Stay informed, stay safe, and as always, use evidence to guide your health decisions. Hey, tomorrow on UroNurse News, are all high-risk prostate cancers really aggressive? Join me as I explore the genomic prostate score and how it's helping doctors identify which tumors may actually be indolent, even in higher-risk patients. Don't miss this essential guide to smarter prostate cancer care.
UroNurse News every weekday at 9 a.m. Central Time.
UroNurse News.